Well, I've had problems since I was probably in my early to mid-30s with circulation in my legs. For instance, whenever I would be doing a gardening task and would bend into a squat position, whenever I would stand up, I was very dizzy and I would actually have to shake my whole body to keep from feeling like I was going to fall down. And then I started having just excruciating cramps in my legs. My calf muscles would tighten up, just stiff as a board. And sometimes it would be during the day and I would just have to really walk it out, and it just took a few minutes, but it was very painful. And sometimes I would be sound asleep and wake up with this excruciating tight muscle in my leg, and I would actually have to jump out of bed and walk that out. My primary care physician told me about 3 years ago that it was not just a cosmetic thing, because as I said, I've had the sclerotherapy and I've spent a lot of money on it, and the broken blood veins kept coming back, and I just quit just a few years ago. But my primary care physician said, actually it would be better for your health if you go ahead and have some sort of vascular surgery, because it will make the circulation so much better. And I just didn't get to it right away, but then I started researching, and Dr. Kingsley, of course, is world-renowned, and I was very impressed by the things that I read about him. And then once I met him, it just sealed it. He is such a wonderfully kind, caring physician who listens to his patients. They did the ultrasound and both legs were weak in the circulation, and so he did one leg first and then he did the other leg, and I have not had any cramps since the surgery. It was wonderful because I don't remember anything from the surgery, and afterwards there was very little pain, and he had explained everything so well up front, and then they give you such good written follow-up procedures that if you follow them carefully as I did, at least I did not have any problems at all. And his staff was good, and of course I love those hose. I have had different support hose, and these are better because that's one thing. I've tried many things over the years, and with the sclerotherapy I would always get the hose, and I've never had any that fit quite as comfortably and also were stylish. They come in different colors. The main thing is the fact that I have no more pain. I don't jump, and that was my thing, were really the cramps. I had spent so much on my legs and been so disappointed in the sclerotherapy. I had actually spent at least $2,000, if not more, because it's $300 or more per treatment. And well, over the years I probably spent much more than that because I kept getting more and more, and it would take longer to get rid of them, and then it just became a hopeless cause. And so when I came to him, it was because of the circulation, and because my primary care doctor said it would actually be good for my health. And so the benefits then have been that not only did my insurance pay for this because it was a medical, not really a cosmetic problem, but it's made me feel better and actually look better, and I have not worn anything like even capri pants in years. And so this year I bought some, and I plan to go to skirts because my knee length skirts, I've worn long skirts in the past. So all in all, it's just been a wonderful surgery and outcome, and I am just very taken with Dr. Kingsley as a caring and very knowledgeable surgeon.